Hi, I'm Dr. Ashley Hughes. I'm a veterinarian at the Friendship Hospital for Animals in Washington, D.C., and I'm going to talk to you about some common health problems that can arise with your dogs and cats. So your beloved companion is starting to get a little older, graying around the muzzle, and maybe slowing down some. How can you make sure that there are no underlying diseases lurking? We recommend that owners have pets over the age of 9 have senior blood work done every year. This includes a complete blood cell count, or a CBC, a chemistry panel, and a urinalysis. Cats should also have their thyroid checked. This should be done every year as part of their senior wellness exam. These tests not only alert us to the diseases that may already be present, but they can also serve as a baseline for problems that occur in the future. In addition to an exam and blood work done by your veterinarian, there are a few things you can do at home to keep your senior pet healthy and happy. I tell all of my pet owners to start giving fish oil for the omega-3 fatty acids, which benefit every body system, providing antioxidant and anti-inflammatory effects. After 9 years old, pets should be switched to a senior diet to better meet their nutritional needs. Finally, the best thing you can do is to keep your pet at an appropriate weight. There was a study done by Purina that found dogs kept at a healthy weight lived on average 2 years longer than overweight dogs. I know I would want an extra 2 years with my dogs if I could have that. I often find that when I recommend senior blood work, people opt to wait, reasoning that, well, Fluffy seems healthy, I'm not concerned right now. I know it can be expensive, and more often than not, everything is normal. But if we catch something early, then perhaps we can start treatment before it becomes a problem. Here's an example of a lovely 9-year-old cat named Mittens that I saw recently for his yearly exam. His owners reported that he'd been doing great, except maybe he was vomiting a little bit more than usual. Mittens was a very handsome cat, but physical exam revealed he had a heart murmur and pretty significant dental disease. I recommended that we do pre-anesthetic blood work for the dental and to see if there were any indications as to why he was vomiting. I advised the owner to see a cardiologist to have the heart murmur evaluated before anesthesia for the dental cleaning. Mittens' blood work revealed that he had very mild kidney disease, which is very common in older kitties. Though we are not able to prevent kidney disease, the earlier we can detect it, the better chance we have of managing it, which is why we strongly suggest that all senior cats get blood work done as part of their regular wellness exam. Clinical signs to look for related to kidney disease would be decreased appetite, vomiting, weight loss, and you may often notice that your cat seems to be drinking and urinating more. So at 9 years old, Mittens had just entered into the realm of senior cathood, and he was found to have 3 very serious but also manageable diseases. Given his heart murmur and kidney issues, cleaning his teeth now is even more important than before. In a healthy animal, and people too, every time you eat and chew, bacteria are released into the bloodstream. With diseased teeth, the amount of circulating bacteria increases. These bugs can then lodge in the heart, kidneys, liver, and lungs, causing disease. Thus, I didn't want Mittens' dental disease to make his heart and kidney disease worse. It's pretty cool how everything's connected. Mittens had his heart evaluated by an echocardiogram, which is an ultrasound of the heart. The cardiologist found there were only very mild changes present and felt he would be safe for general anesthesia. Mittens had his dental. He only needed 1 tooth extracted, and he recovered very well from anesthesia. We switched him to a kidney-friendly diet to decrease the workload his kidneys had to do, and scheduled to have a kidney function evaluated in 6 months. I feel that Mittens' case is a very good example of why annual exams and senior blood work are so important. All of his issues were at the very beginning stages, and with proper management, we can keep him as happy and healthy as possible. Thank you for listening, and all of the information that we talked about can be found at www.friendshiptails.com. If you'd like to send me an email, you can at ahughes@friendshiphospital.com. Thank you.